questions now.
Yeah, you're
So.
absolutely right. So we'll get rolling so you can get to your stuff and I'll get to mine. But
Yeah, man.
like the format is super chill. Like I was telling you last time, like I'll just be like, tell me a little bit about yourself. We'll kind of talk about, your history, where you grew up, how you ended up where you're at right now, how you ended up being a chiropractor, and then kind of your path right now, which is not what a normal chiropractor does.
Right.
I got a really good friend who's a chiropractor and, he's very of the traditional sense. You come in, you get your exam, this, that, and the other. I got another friend who's like the crack and you're out the door. He does 60 patients an hour, So like, I've seen a ton of it, but I haven't seen anybody like do the things that you do when it comes to dealing with the root cause of the issue versus just saying, hey, yes, chiropractic is good, but I'll crack you and you'll come back versus, hey, here's some, body, nutrition and sleep and all these other things that you're coming up with. So that's kind of like, it'll go wherever it goes. Like we may never talk about food, but we'll see.
Dude, it doesn't matter to me, man. And like, I'll just talk about whatever, but no, we totally talk about chiropractic and the things I do. So, what we do is very unique. I will say that. So,
dude, and it's totally needed too. Totally needed. Like the fact, and I love how you're presenting it too. You're not like this stuffy guy by the whiteboard. You're like, here is why you
right.
You got like the cool video rapping going on and
dude, it is honestly, it can be a bitch sometimes, dude, because I have to take like multiple shots because dude, sometimes I'll rip it off and like something will happen or like the freaking thing won't come off or like I don't know, and it's just freaking annoying. Or like, dude, one time I did a perfect shot and my mic wasn't on.
Serious? Your mic wasn't on?
Yeah. So like on my mic, there's like one for smartphone and then there's an option for camera. And I was using my DSLR and dude, it like, oh man, it was so frustrating. So.
No, but see, now you learn. What do you always check? You always do a dry run, huh?
Oh yeah. Like big time. Like I always like before I even turn the camera on, I'm like, okay, what am I going to say? How's it going to be? Because dude, I'm super quick because it has to be 60 seconds to be on Instagram feed. So like, I'm like, okay, boom, boom, boom. And then I like, I go up to the camera and it's like 1 minute and 4 seconds. And I'm like, fuck. And I have to freaking do it again. So,
dude, there's a couple of apps you can get like a big ass timer and just set that in front of you and have it count down. And then like, you already know.
Yeah, I was doing that with my phone. Like when I was going on a dry run, I was like, I did it and then I would do it and I'm like, okay, I'm getting it pretty good. But when you really do it, you tend to go a little bit longer,
Yeah. That's the timer on the iPhones is super small, but they have like, have you like at the gym, right? The big red ones. So like you can out of the corner of your eye still see it while you're looking at the camera kind of a thing.
That's a good point, man.
Yeah. It makes
it cool, man. Well,
it's all about the cheat codes, man. That's all we're trying.
Gotta level up, man.
All right. I will get started. All right. So I'll do just a quick intro and then throw it over to you. So
sweet, man.
Hello, brothers and sisters. This is Garrett Bake, your brother in arms, and welcome to another episode of The Tactical Businessman. Today we have a special guest, TJ Woodham, who is coming to you live and direct from
Gillette, Wyoming.
Don't worry. I didn't know where that was either. That's why he's wearing the cool flannel and I'm not.
Yep.
So TJ has been a chiropractor for quite a few years, but the reason I wanted to get him on the show is he's not your traditional chiropractor. So if I said chiropractor and you're ready to turn this off, hold on, pay attention. He's actually a cool dude and he'll shoot it straight. So with that being said, I want to introduce again my guest, TJ Woodham. TJ, welcome to the show.
Thanks so much for having me, man. Honestly, like it's absolute pleasure to be in relations with you, man. And I know you've been on my podcast and we had an excellent time. So I'm really, really stoked to talk about what we're going to be talking about today, man.
That's very cool. Very cool. So last week it was really interesting because I spent some time diving into like connection, right? And we talk about what a man really wants in life. and a businessman especially is like, they want to be connected. They want to be connected to their business. They want to be connected to their family. But one of the things that they always seem to ignore is their bodies. And it's interesting, the correlation between your body and your ability to produce, your body and your ability to be present with your family, and there's so much that goes into it. Now, I will say this as a disclaimer at the beginning. I am not an expert. I'm not a trainer or anything of the sort. However, I do have some life experience. That being said, that's why you're here, because you are the expert. But before we start talking about that, I want to know a little bit more about you. So tell me, like, where you grew up and like that life story that put you in Wyoming, where you are today.
Absolutely, man. And it's actually a fascinating story. So I was actually born in Atlanta, Georgia, moved to Tampa, Florida at the age of 10. My whole life I've been in athletics. I was a baseball player, played soccer, basketball, football, typical jock, right? So growing up, mostly played baseball, always been into human performance, trying to take myself to that next level. And it was around college time when I was at the University of Florida. I was actually an athletic trainer on the University of Florida's football team, the Florida Gators. And, like being an athletic trainer, I'm around the athletes, I get to see all the therapies, modalities that they're getting. And it was honestly a dream to have that kind of job. And I remember the time I was, doing my pre-medical studies. I was, trying to go to dental school at the time. And my buddy calls me and he says, "Hey man, like, I know you've always been into athletic performance and all the kind of modalities that go into that. Have you ever thought of being a chiropractor?" And I was like, that's interesting, man. Actually, I have thought about it before, and I never really took a deep interest into it until he started telling me all the crazy things these chiropractors were doing, like healing people from autoimmune diseases, like things that are deemed incurable by the medical community, and even helping people with posture and regain their life through nutrition and adjusting the spine and stretching the spine into areas where it would be more favorable for their life. And so I was like, man, this is really cool. And, I would rather go down that path of human performance and excellence rather than looking at people's mouths the rest of my life. I mean, who wants to smell breath and look at nasty teeth all the time, right? Not to offend any dentists because they do amazing work, but
hey,
when you look at it that way, right? Oh, look, there it is, man. Nice. Yeah.
I just showed him my retainer. I got my braces off a little while ago. So
I know all about nice, man. Well, congratulations.
Thank you.
But that being said, we as chiropractors actually have a really good relationship with dentists, because my line of field, my actual specific technique in chiropractic is very much aligned with dentists. And we'll get into that in just a moment. But I realized, man, like, this is my calling, man. Like, I have to be a chiropractor because it like takes people's bodies, their mindset, and their entire health to levels they never thought was possible. So I went into chiro school, graduated, and then I actually got certified in chiropractic biophysics, which is a specialty of chiropractic that looks at the posture of an entire person. So we don't only just lay you down and crack you, like the traditional chiropractor that'll, lay you down 1 minute, get off the table, next one, and don't get me wrong, traditional chiropractic is amazing for the spine and for the health of people. But my certification in chiropractic biophysics looks at your entire spine and the biomechanics of everything in your body. So we take spinal x-rays every day to see if you are off any kind of alignment, whether that's from your neck all the way down to your butt bone. And so we know that when any kind of shifts in your posture occur, it can actually impinge on those nerves going out to your heart, your lungs, your brain, your eyes, your ears, all the way down into your reproductive organs. And so, guys, we know that if there's issues with your low back, your lumbar spine, if it's shifted out of alignment and it's out of that normal posture that your body deserves to be living with, you can actually have erectile dysfunction. You will have the inability to have kids too. We see this a lot even in women too. So it's very interesting, this correlation between biomechanics, your organs, and your overall health. So as traditional chiropractors, like I said, they typically just do the normal adjustment, but we take it much further with exercises, whether that's therapeutic exercises, spinal traction, and we do the adjustment. So we take chiropractic to a whole nother level to make sure that your mind, body, and everything in your life is just taken to that next step.
So let me ask you, it's really interesting that you say that about posture and a lower back and stuff. Obviously being a police officer for 15 years, I have a lot of friends who've retired, have lower back issues, but also a lot of officers who are still on the department that are struggling with these lower back issues. And the doctors, of course, are recommending, spinal fusion and some of these other things. Whereas what you're saying is there's actually a way to basically fix it or circumvent having to go the surgery route.
Mm-hmm. Absolutely, man. And one of my really good friends is a police officer, and he tells me all the time, man, I really want you to move back to Tampa so that you can fix me. My parents are in Tampa, Florida. That's where I grew up. And so he says, man, if you move back, I will get the entire police force to come to you, because I know guys just like me who are in pain all the time because we're sitting in our squad car for 12, 15 hours a day. We're wearing these vests that are pulling us down. Like, their posture, and you know this better than anyone, Garrett, like your posture in that car, like the vest is pulling your shoulders over and rounding you so much. It puts a lot of strain, discomfort on the discs and the nerves in your low back and in your thoracic spine and your neck. And so a lot of times we'll actually see police officers, they'll come in, we look at their spine and it's absolutely trashed, man. We look under the scope of x-rays and we really like determine, hey, how are we going to fix them? And are we going to be able to fix them? Because, there's no guarantees that we can fix everybody. We don't want to be like, hey, listen, man, like this technique works for everybody, because everyone's different. Just like the way that somebody could be allergic to eggs or even salmon, right? So when they come into our office, we look at someone as an individual, not a number, right? We make sure that we do all the orthopedic testing, neurological testing to really make sure, hey, can we help this person, right? And so I'm really glad you brought that up, man, because everyone's so different, right? And so we look at their spine, really make sure, hey, look, can we do some kind of things here and there to really take the pressure off the nerves of the low back or anywhere else in the spine? So back to your question, man, yeah, we see a lot of law enforcement people, and honestly, they're the best patients because they're dedicated. They know what's going on. They get it, right? And so they know it's really, really important for their health and to help other people outside, in their line of duty. So
what about, let's talk about businessmen in general. Like businessmen, if you're in an office or you're a traveling salesman, like whatever it is, you're also spending a lot of time in a seated position. Like, how does that affect like your overall health?
Yeah. So sitting, we know, is so rough on your back, man. Like we sit so often now that it's crushing those discs, crushing the nerves coming out to your organs and everything in your body. So what makes us different, we don't only just adjust and do traction in the office. So traction, and another way of saying it, is when you lay down either on a bench or lay in a traction unit that'll pull and stretch your posture toward more of a favorable posture. So let's say that my shoulders were rounded, right? We will have you actually sit or lay down in some kind of traction unit that'll actually roll your shoulders back, open up the thoracic cage, and allow you to either breathe better or decrease pain. Now, as far as businessmen, we know they travel a lot, right? And so the biggest thing with us is that we actually give people home care. We actually give them custom orthotics to place specifically where they need it in their spine. So a lot of times in the hotels when businessmen are traveling, we give them these little foam orthotics that'll actually be placed in very, very specific areas to open either the thoracic cage or open the lumbar spine to take the pressure off the discs and nerves. This is huge for businessmen. We see a lot of people that come in and out of our state because this is a really, really big time working state, whether that's coal or oil or what have you, big time businessmen come in here and they travel all over the place. And so they always come in, oh man, doc, like I've been on the plane this much. I've been traveling all over the state. I've been doing this and that. And we always ask, hey man, how's your home care been? And a lot of times they'll say, it's not been so great. But they will always say, but you know what, doc, when I do it, I feel so much better. And it's like, well, of course, man, that's why we gave it to you. So really, businessmen, though, they are really good patients because they know, like they're sharp. They know, they have schedules. They know when to do it. And when they do it, they do it properly.
So let me ask you a couple of questions. Like we've talked a little bit about, chiropractic work and the importance of when you have a problem, getting it taken care of. But let's like attack the other side, because I think this is actually where you shine, and that's like preventative. Like on the front end of things, you don't have to end up laying on a table in a doctor's office because you literally can't move anymore. So like, let's talk about a couple of those things that you think are most important when it comes to preventative measures. Like what will allow a man who sits in a car a long time or sits in a desk at a long time, like, and gets cramped up, not just mentally, but physically, obviously they're all related, but will allow him to achieve the physical clarity and therefore the mental clarity to perform.
Right. Yeah. And the problem with that, man, is that a lot of times some people won't have any pain. They'll come into the office with really bad spines, but they don't really have any pain, but they're dragged in by their wives, right? Mm-hmm. Like women are literally the biggest drivers of healthcare today because women innately know, hey, you need to get your ass in that office or else I'm freaking divorcing your ass, right? Like, you know, not get that crazy. But in reality, the women are always looking out for the men and the family, right? They are the caretakers and they know innately, hey, listen, like you need to get in there or your spine and health is just going to go down the drain. So it's typically a lot of times the women will drag the men in, and the men, you know, they don't have like a lot of symptoms, but when you start asking them questions, they're like, oh, wow, you know what? I do have those headaches. Oh, wait, you know what? I do have erectile dysfunction. Oh, wait, you know what? And so because men don't want to accept the fact that they have weaknesses almost all the time. And so they'll come in, right? We'll take x-rays of their spine and we'll say, man, like you've been living with this spine this whole time and you had no idea that this was going on. And then they start realizing, oh shoot, man, I got to take care of this now or else this is only going to get worse, right? And so the thing about preventative measures is that if they get in earlier, that'll help them for the rest of their life, right? And so a lot of times people wait too long. And then it comes more to like a crisis care thing. It's like, holy shit, man, like we got to get you out of this problem now. Like if they're like 40, 50 years old, like they've had so many years of generation in their spine and their nerves that like at that point, it's like we're doing as best as we can to help their spine. But on a preventative measure, honestly, man, if people were to come in earlier and just get their spine checked like way earlier in life, that would help so much more with their focus, not worrying about pain all the time, not worrying about their posture, because they already knew from an earlier age that their spine dictates their overall health. Right. Spine literally, like, I mean, your brain sits on your spine. That's the only way you can move, think, and take your body through life, man. Literally connects right into the spine. So people forget that your spine is the most important thing in your body, right? If you take care of your spine, it takes care of you. So on a preventative approach, man, I personally think everybody should get an x-ray at the age 20. Why 20? Because people are still developing all the way up to like 20, 21 years old. Like people are still growing. So when you take a picture of a young kid, sometimes there's still things moving around. But I think that people owe it to themselves to look at their spine because it's honestly the master control center coming down from the brain. So in that aspect, man, like it should start early in life. And at that point, like I said, the home care we send them, the education we give them in the office will really help preventing any kind of disease or decay over time. So
that's really good information. I want to kind of shift the subjects just a little bit. I want to talk about nutrition. Like outside of you being a chiropractor, you had a really interesting journey down this path of nutrition because you were an athlete, right? You grew up. And so you kind of did what everybody around you did, right? They're like, here, take this supplement. Here, eat as much protein as you can. Here, you need to carb up. Here, you need to, here, you need to, here, you need to. And I remember you posting a picture on social media that showed two versions of you. One that was super unhealthy, slamming a bunch of stuff, and the other one that was like super healthy. So like, talk about that process. What happened?
Absolutely, man. I love that question. So like I said, athlete my whole life, right? Wanted to be aesthetically pleasing with my shirt off. I wanted all the girls. I wanted even the guys to admire me, right? So in college, I really got after it. I took protein shakes, slamming whey protein shakes. I'm talking 3 to 4 times a day. That's how many protein shakes. I was having protein bars in between each of them. I did more of like kind of like a bodybuilding type diet with a crap ton of canned chicken, canned tuna, and just all of this nasty stuff, man. I mean, that crap was lined with BPA and like all of these nasty ingredients. And honestly, man, I didn't care. I took pre-workouts that were like 300 to 400 milligrams, man. When I was in the gym, man, I was hearing colors and seeing sounds. That's how messed up I was off these pre-workouts. And I did that for a year. I worked out 7 times a week. Literally, I took no breaks. My rest days were doing things like sprints, deadlifting, and cleaning up any kind of movements that I wasn't performing that well on. So I didn't take a break for like a year and a half. Granted, my body, I was like shredded. I was like 5-6% body fat. I was like 185 pounds. I was benching like 315 plus pounds for reps. I was squatting 405, like deadlifting 400, like I was a freak. I mean, whatever. But the reality is I was driving my body into the ground. My nutrition was not where it should have been. I was eating just absolute garbage. And because of that fact and stressing my body by going to the gym so much, I started getting eczema all over my skin. Now, people that don't know what eczema is a skin condition that literally will destroy someone's life if it gets bad enough. It's itchy, it's dry, it cracks, it bleeds. And so I was like, what the hell is going on? Why do I have this all in my body? Like, I'm supposed to be like this healthy guy, right? And like all I cared about was just showing off my guns in the gym and being the strongest guy. And I could give a crap about my health at that point. But it really came down to is like, man, I'm sick. I am sick to hell, man. So it came to that point where it's like, man, I got to do something. And so I went to a dermatologist to give me corticosteroid creams. Didn't work, of course. And so I went down this road of trying to do detoxes. Eczema got so much worse until I got to see my mentor in chiropractic school, who is a clinical nutritionist. And long story short, he broke me down by eliminating all these nasty things and then building my body back up to the point where I could actually sustain a healthy life by working out and doing a whole kind of like different diet and working out more in a way that was actually conducive for human health. And so going back to that, when you were talking about that post on my Instagram, there's a picture that shows me when I was a bodybuilder, like absolutely shredded. But then there was another picture of me when I was doing a whole foods diet, when I was just doing a paleo type diet. Now, I'm not a massive advocate on just following one diet because I think everyone's different, but it was a whole foods diet, with grass-fed beefs, organic cuts of any kind of meat, wild caught fish, vegetables. Like my entire plate was covered in vegetables. But if you look at the picture, I actually look much healthier on the other side with the whole foods based diet. And like, I was still shredded. I was still cut and I was still in an awesome weight and I was doing it the right way. And I noticed my relationships were better, not only with myself, but with other people. My focus was better. My energy was better. I loved my life. And that's how I eat now. And it honestly gives me so much clarity as to who I am, what I'm doing, and where I'm going in my life. And for anyone who's looking for any kind of like nutritional advice, honestly, you got to figure out what works for you, because there should never be a label for dieting for just one person. Like everyone's different. And if I were to say anything, you should do a blood test to see if you're allergic to certain foods, because you could be eating so-called healthy foods like avocados or almonds or like salmon, and you could actually be allergic to them. So that's my story in a nutshell, man, with all of the bodybuilding stuff.
I love it. I love the tie-in that you had there at the end. Like I kind of want to go a little deeper on that. Based on what we see on social media and on TV and, just around us, we think that being healthy equates to being able to lift the most, having a six pack and these other things. And so we push so hard down this idea of a quote unquote healthy body. We end up, like you said, is like internally tearing ourselves apart. So I want you to go a little deeper into this idea of how it shifted not only how you felt about yourself, but like the environment around you, the relationships you had, the conversations you were having, and things like that.
Yeah. So when I started taking the focus off my body, I started focusing on other people. I focused on other people in a way where it's like, hey, it's not all about me. It's about helping other people if they want to get to that same place that I was at, having the body that I had, but in a healthy way. And I realized there's so many people that are just doing it so wrong. And so when I really started realizing, hey, like there's so many people that would love to have what I had, but if I could do it in a way that would actually be healthy for them, I'd totally love to do that. And so when I started taking my mind off of myself, I started helping other people in many other ways, like communicating with them with the things that they really wanted in their life. And it really gave me a good understanding of who I was. And it gave me like this awakening. It's like, hey man, like stop thinking about yourself. Like stop being like a selfish piece of crap, right? Like there's other people out there that could benefit from your knowledge and your expertise without acting like you know it all, right? Like at the time, I thought I knew everything, man. I thought I was the ruler of the world. I walked around the gym like I was shit, right? Like I walked around like, yeah, no one's stronger than me, right? Like I'd walk in and like, this is awesome. But it's like, who cares, man? Nobody is going to remember how you looked back then, right? Nobody. Like, sure, you can look back at pictures and like gloat and say, hey man, that's how I used to look. But it's like, people are going to be like, I don't care, man. Like they'll be like, oh man, that was crazy. But at the same time, they're like, man, this guy's an asshole, right? Like it's not about you. It's about other people and how you can serve them. So when I started realizing, man, like I could start helping other people either lose weight, get better skin, or just have a better life, it took the focus off me, put the focus on them. And that's when I really started helping people online with like, you know, either kind of like health coaching or even in the office about how to lose weight, how to live a better life, how to better like take your mind to the next level. And it honestly really shifted my focus so much, man. You know, and as a kid, I was just, and because I call myself a kid because I was only like 22, 23. And I was saying to myself, man, like, how could I be so selfish? And I don't know, it really took me to that level where I am now, that people really, really want guidance. And to be in that place that I was at and learn from my mistakes really allowed me to grow as a person and a practitioner. So through my own struggles, it made me realize, hey man, like there's more to life than having a fantastic body. And to go back to your comment about people think that being big and cut is healthy. Actually, the more muscle you have, the harder your heart has to work. Like your heart has to pump much more blood and it has to pump much harder to keep those muscles alive and healthy. So that's why you see these bodybuilders, man, I can't even imagine what's going on the inside. They are super, super unhealthy, honestly. So, and you'll see like a lot of times bodybuilders will actually die from like heart complications, cardiovascular issues, because the heart has to work so much harder. And I think people don't understand that, but you know, we put them up on this pedestal and say, hey man, like I want to be like that guy. I want to live that life. I want to look like that. I want all the girls. I want all the money. Who cares? Like, who cares? So that's kind of how I think about it.
I love what you're saying. Just go back just a little bit is this idea, and I talk about this all the time, is that the body is the gateway to power. Like if you can't take care of your body, you're never going to have good relationships. Like your ability to make and keep money is going to go out the window. Like life won't have a purpose anymore. Why? Because you're so focused on yourself. But
Right.
when you're able to take care of yourself, learn how to treat your body properly, and it doesn't become a burden for you, now you could shift your focus into creation mode, right? Create a better relationship with those around you, you know, create a business that helps serve other people. And I think people miss the boat on that. Again, getting stuck in the whole, I need to spend 2 hours at the gym every morning. I need to take all these supplements all day long. I hate it. It's horrible for me, but I want to look this certain way. Just because I want to get a like on Instagram, or I want somebody to give me a fist bump and like grab my arm and be like, oh dude, you're so huge. But none of that even matters, right? At the end of the day, like you have a girlfriend, right?
I don't actually, no.
Oh, I thought you'd had a girlfriend, or you had for a while.
Well, I did. Yeah.
And she's gone. Oh,
she's gone.
Sorry to hear that. I'll speak from my experience. My wife has never really cared like how big my muscles were, like ever.
Right.
She just cared whether I was able to take the kids to the park and play with them.
Right.
And it's so much of that goes into, like you were saying, your nutrition, your ability to care for yourself. And going back to, police work, sitting in a police car with that belt, 10, 12 hours a day, like I was having back issues where I couldn't play with my kids. I would get home, I would pop some, ibuprofen, or if it got bad enough, some Vicodin, and then I'd lay up on the couch. And so you start thinking about, well, like, what's my quality of life? Like, what am I actually living for right now? And so I love the fact that you've centered your life around helping other people, but it was a process that you had to learn first.
Right. Yeah. And you know what? I actually, going back to that. So one of my ex-girlfriends, she actually, when I was really cut and like I had really good muscle tone, I still remember when she would lay her head on my chest or on my arm, she was like, TJ, you're too solid. Like, I can't find a comfortable spot. I don't like this. And she even would tell me, you're like too cut. I don't like it. So dude, you're totally right, man. Like us guys, we think these girls want like these shredded, jacked guys. When it's like, it's a guy thing, man. Like, it really is. Like, what a girl really cares about is if you support them, right? And like financially and emotionally, right?
Dude, you hit the nail on the head. And like, I want to give you credit because most men never figure this out. Women want two things. They want safety and security. They want that emotional support, and they want to know there's a roof over their head. They can buy groceries. They can take care of the kid. Like, that's all they want. You give a woman that, you will have unlimited sex. Yes, I just said that. Give a woman what she wants. You will have unlimited sex. Fulfill her. She will fulfill you. Boom. We just summed up this whole podcast. That was awesome.
Yeah. Done.
Oh, nicely done. Nicely done. All right. So I want to finish up with a final question for you. Like, where do you see yourself being in 10 years?
In 10 years. So where do I see myself? I see myself in a few publications, research publications. I see myself an authority not only in chiropractic, but also an authority in the nutrition and wellness space. I see myself on stages telling people, listen, you don't have to live the life that you thought you had to live growing up. A lot of people are brainwashed by the medical community. I will, a side note, medical doctors are amazing at their scope of practice, right? So the things that they were taught in school is exactly what they are supposed to do, right? It's not their fault, right? And we know a lot of functional medicine doctors are coming on board to do more nutrition and holistic type stuff. But the reality is people are sucked into this idea that they have to go down this path of vaccines, medications, all this other stuff, when in reality, health comes from outdoors, right? Like, we've been living off this planet for thousands of years. Like, nutrition, wellness comes from nature. That's why we eat food. That's how we stay alive, right? So my goal in the next 10 years is to influence hundreds to thousands, maybe even millions of people through social media awareness, being on stages, and help people attain the life that they really deserve. People don't have to live with disease. These diseases are so new to us. There's things that are popping up that we've never even heard of, and we're classifying new diseases like it's going out of style, man. So people don't have to live with all of this struggle, right? And even in their mental mindset, man, like, if you spend like an hour or two on yourself every day in the morning, I know you do the hour, the power hour, right? Mm-hmm. If you spend your time on yourself in the morning, man, that makes all the difference. So getting out of your own head, but bringing in new quality things like, doing positive affirmations, working on your body, working on your nutrition, that changes your life in so many ways. People don't get it. So my goal is to bring more awareness to that. And I know there's a lot of influencers out there that are doing the same thing, but I hope to take my voice to the next level so people can really understand, hey, I have one life. Let's freaking take it to the fullest potential possible.
Beautiful. Beautiful. Love it. Love it. TJ, thank you again for taking the time to be on this podcast. I really appreciate it. And listen, if you're listening to the show right now, take what it is that he has shared with you and don't just like say, oh, that was some really good information, and then like forget about it as soon as you get home. Like start taking care of yourself. Like your access to power is through your body. And you heard from a doctor here who didn't just talk about the importance of taking care of yourself with radical or regular medical treatment, i.e. chiropractor and blood work and whatnot, but also like it's about what you put inside of you. As much as you like to think it's not, it really is. So you want to live a better life. You want to be more present with your wife and your kids. You want to be able to function at work and create a better business. Start taking care of yourself. All right. That is it for today. As always, if you can follow me on social media, I'd also tell you to give old TJ a follow. TJ, WOODHAM. Follow him on social media. He is on Facebook. Is it the same Instagram handle? What's your Instagram handle?
The Instagram handle is The Unleashed Human. And I have honestly like crazy free content like every single day. And I also have a free, my actual book is a free link in my Instagram bio. So if you want that, it's a PDF. You can totally grab it. So check that out.
Beautiful. The Unleashed Human.
Yep.
There it is. So give him a follow, especially if you are stuck trying to figure out what it is that you need to do with your body right now. So as always, though, I want you guys to pay attention to what really matters most in life, and that is you, because if you can't take care of you, you'll never be able to take care of those around you. As always, stay safe, and we'll see you guys on the next one.